Hello everyone, I am Dr. Poonam Rudingwa, Consultant Obs Gynae at Motherhood Chaitanya Hospital, Chandigarh. I will be discussing about contraception. As the name suggests, contraception means against or to prevent pregnancy or conception. Contraceptive methods are the preventive methods available for a woman to help her to prevent the unwanted pregnancies so that she can save herself from abortions. So, what is the need for contraception? The need for the contraception or the goal of contraception is to prevent the unwanted pregnancies. To regulate the timing of the pregnancies means when a lady wants a pregnancy or when a couple wants a pregnancy, to have a pregnancy at that time, and to regulate the timing or the interval between two pregnancies. What are the properties of an ideal contraceptive method? They should be safe, easily available, effective, affordable, long-lasting, reversible, and above all, they should be requiring minimal or no medical supervision. Discussing about the contraceptive methods, there are two types. One is spacing method and one is terminal method. Terminal method includes sterilization, that can be for the male and the female both. Sterilization can be done during a cesarean, after a vaginal delivery in case of a female patient, or after she thinks that her family is complete and the younger child is more than 5 years. For a male, it can be done anytime, unrelated to the pregnancies of their spouse. The surgery for females is called tubal ligation, and for the male it is called NSV or non-scalpel vasectomy, in which there is no cut. Coming to the spacing methods, various spacing methods are available, like the barrier method. There are hormones, there are IUCDs or the copperities, there are implants, and there are injections. Coming to the barrier method, the commonly used method, which includes the condom. It can be both male and female condom. There are diaphragms for the female. There are spermicidal jellies and tubes available. Next is IUCD, the most feared, that is the intrauterine contraceptive devices. There are two types. One is non-medicated and the medicated. The non-medicated can be used for 3 years, 5 years or 10 years, whereas the medicated ones are for 5 to 6 years. The next one is the hormonal, which come in form of combined pills or the commonly known as 21 days pill or single hormone or the progesterone only pills. There are injections, there are postcoital pills, and there are implants. The last method or the most non-dependable or non-reliable method is the natural method or the coitus interruptus, which should not ideally be followed. Coming to the efficacy means which method is most effective in preventing a pregnancy. If we see, the best ones are the hormonal and the IUCDs. The last will be barrier and the natural method. Now the target population which needs contraceptive advice or counseling is reproductive age group men and women from the age of 15 to 45. The contraceptive options or the methods available should be a part of the sex education in schools, and parents should educate their children, adolescent children, regarding the contraceptive method, because prevention is always better than cure, to prevent them from going for abortions, because abortions does harm the health of the lady and can have serious life-threatening complications as well if not handled properly. So contraception is a topic which is not very comfortably or casually discussed but should be encouraged. The timing for any couple to come for the contraceptive advice is just before marriage, after their first child, and after their family is completed, and should be a part of sex education for adolescent kids.